Hello and welcome back to GP Video Podcast by Nadia. Today our topic is sleep apnea. Sleep apnea is a big problem, but the problem is that most of the people don't know that they have got sleep apnea. 15% of the population of developed countries suffer from sleep apnea, but most of the people don't know about it. So what happens is how they will present to the clinics is they will present with lethargy, increased sleep, sleepiness, and then daytime lethargy and drowsiness, and feeling tired all the time, and maybe because of that feeling depressed as well. So as I said that most of them don't know it, it is a big problem because sleep apnea leads to daytime sleepiness, lack of concentration, cognitive deficits, morning headaches, and the sleep is often interrupted because they start choking or gasping. Left untreated, if we leave sleep apnea untreated, it does cause high blood pressure. It's associated with heart disease, kidney disease, type 2 diabetes, and even fatty liver. It's vital then to figure out if we are part of the 15% of the population that suffers from sleep apnea. And then how to treat it. So first of all, diagnosis that we do suffer from sleep apnea, and number two, how to treat it because it destroys longevity. Sleep apnea is when the airway gets blocked while sleeping, and there are periods of time when we are not breathing. It causes blood oxygen levels to plummet and blood pressure to skyrocket. And the body thinks that it's under massive attack, so it actually activates fight and flight response, which is the sympathetic nervous system, therefore boosting heart rate, the stress hormone cortisol, and overall inflammation levels. In short, it's metabolically terrible for the body, and it starts affecting our day-to-day activities. Now, how to know if we have sleep apnea? Some people, they are so used to feeling tired that it just becomes their new normal. And it's only once sleep apnea is fixed that they get a new lease of life. Now, with the patients that we see in the clinic, we can ask them 8 simple questions. So it is a questionnaire that is very easy to do, and even patients can do it at home, and we can also ask these questions when we are suspecting that the patient has got sleep apnea. So number 1, are they snoring? Number 2, do they feel tired? Number 3, has anyone actually witnessed that they have stopped breathing at night? Number 4, what's their blood pressure? Number 5, what's their body mass index? That is the calculation of the ratio of their height and weight. And what is their age? What is their gender? And what is their neck circumference? So again, I'll repeat the questions. Number 1 is, are they snoring? So of course the partners or the kids or other people who live with them in the house can tell whether they are snoring or not. Otherwise they can use the sleep apps to record that whether they are snoring or not. Number 2, do they feel tired? Number 3, has anyone actually witnessed that they have stopped breathing at night? What's their blood pressure and body mass index? So of course, high blood pressure and high body mass index or obesity are the risk factors. And then what's their age, what's their gender, and their neck circumference. So if the patients score in this questionnaire, if the patients score, because everything has got different scores, if the patients score 3 or more, then that means that they have high likelihood of suffering from sleep apnea. So this is just a questionnaire for screening, and then we move on to confirming the diagnosis. So the gold standard is an overnight sleep study where oxygen and carbon dioxide levels are monitored, as well as blood pressure, heart rate, and breathing rate. It's a quite expensive procedure to do, which is why we can often recommend patients to do a sleep home study when there are monitors which can be rented for 1 or 2 nights, and then they give us fantastic information to help our journey to correctly diagnose sleep apnea. So it's in different countries, there are different procedures. Either you can spend a night at the sleep center and get diagnosed, or they will provide you with the monitors to be put at home for a couple of nights, and then they will give us all the readings and everything. So it depends on the like, you know, where you should go for it, whether they are PBS not PBS, like whether they are governmentally funded or not, or how much do you have to pay for it. But anyways, questionnaire is the screening one, and then we get the definitive diagnostic testing. And then we come on to the treating part. So treating part again starts with the lifestyle intervention. So in the lifestyle intervention, we would want our patients to start doing exercises. But of course, how will you go for exercise when you're already feeling so tired and lethargic? So then comes the part of reducing weight if we are overweight or obese. So reducing weight, again, diet, exercise, but then medications. As I've always said, that I'm very pro medication for that, but then again, dietitians can help us, exercise physiologists can help us there. And then comes the sleeping position. So sleeping position is very, very important, about which I will talk about what is the correct sleeping position for treating sleep apnea. And then alcohol, how bad is alcohol for the people who suffer from sleep apnea. All this tomorrow in our next video podcast.